So basically, what is xanthelasma? Well, I've got my cholesterol level checked and still I have this. Why so? How to treat xanthelasma? We have a lot of options now depending on what patient is comfortable with. Hi guys, so today let's talk about xanthelasma palpebrum. So basically, what is xanthelasma? Xanthelasma refers to yellowish cholesterol deposits over our upper eyelid near the inner canthus. So basically, patients usually present with such kind of lesions which can be unilateral, that is, it can be present on only one side, or bilateral, and it can even in some patients involve the lower eyelid as well. Now usually when patients come to us, they have this thing that I'm not suffering, I've got my cholesterol level checked and still I have this. Why so? So yes, xanthelasma is not a direct indication of dyslipidemia or hypocholesteremia. So if you have xanthelasma, it is not necessary that you are going to have deranged lipid profile. So of course, but when patient comes to us, we do get certain tests done. So those tests will be anything which can lead to a metabolic derangement, meaning internally any other issue can also be linked to xanthelasma. So when the patient comes to us, we do get certain tests. Firstly, a liver function test, a lipid profile, a thyroid function test, and of course a sugar profile. So basically these are the few tests which need to be done to rule out any other metabolic abnormality. Now next is how to treat xanthelasma. We have a lot of options now depending on what patient is comfortable with. So the most common and easy procedure which is done on a day-to-day OPD practice is application of trichloroacetic acid. So it's basically an acid which is applied over the xanthelasma spot, and it is a self-neutralizing acid. So once there is a mild frost, whitish frost appears, that is like the acid is already neutralized, and we just clean it with normal saline and we send the patient home. It crusts, and the xanthelasma with few sittings it is going to thin out and disappear. But again, this requires multiple sittings and the patient has to come back to the clinic to get the acid applied. They cannot do it at home as it is a very strong acid. They need to come to the clinic. It's an in-clinic treatment, not an at-home treatment. Second option is we can do an RF ablation or a CO2 laser ablation. So basically, these are heat devices which destroy the cholesterol deposit, and for this, of course, there is going to be a slight downtime of 3 to 4 days, and the patient we apply a numbing cream or we inject the area and do the procedure. Again, this is again an in-clinic procedure. Lastly, it can be also sorted surgically. So sometimes we do remove the xanthelasma surgically, and of course there is going to be a suture which gets absorbed, and usually it is not visible in the eyelid creases. So these are the few options which are available. Please do not try at-home treatments like trying to apply certain acids or trying to cut it or use certain garlic paste, toothpaste. Do not use those things. It is not going to help. And yes, lastly, one thing is that xanthelasma is recurrent. It can come back even after complete removal. So yes, sometimes that can be an irritating factor, but then we have to get it removed for cosmetic reasons. So yes, we can always manage, and once you have got it removed surgically or with a CO2 laser ablation, there are less chances of recurrence, but it does not mean it will not recur, but there are always less chances and it comes back late as compared to acid application. We should always try to do one of these procedures. Also, once you've got these procedures and you feel that the recurrence is happening or slight amount is showing, so you can always that time slight ablation with the acid would help. So visit your dermatologist and they will guide you about the procedures. Thank you.